Hello friends, welcome back to Learning Nails and Aesthetics. Don't forget to comment, like, share, and subscribe, as well as check out my other videos. Now keep in mind, I am not AI, so mistakes will be made. You can just laugh along with me. This is a summary of the Milady Aesthetics, Chapter 4, Disorders and Diseases of the Skin. This series of videos highlights the major points of each chapter in the Milady Aesthetics book. If you have not read the book or watched the videos of me reading it in its entirety, you should do so and consider this as a basic introduction. If you have, this is a good reminder of its contents. This is not a substitute for the entire book. I will not be flipping through the pages as I have painstakingly compiled the information. That being said, let's get started. As an esthetician, it is not within your scope of practice to diagnose skin diseases. Use positive words of encouragement and be mindful of how you discuss skin problems tactfully. Never work on any skin condition you do not recognize. When in doubt, stop the service. They will appreciate your honesty and caution. Recognizing a potentially contagious skin disorder can stop the spread of infection. Estheticians may not diagnose or perform services on clients who have contagious or infectious diseases. Dermatologists, physicians, and nurse practitioners are qualified to diagnose skin problems. However, once diagnosed, estheticians can help clients with many common disorders and conditions such as rosacea, acne, and hyperpigmentation. Caution and strict infection control practices are imperative when working with skin disorders. Knowledge of skin conditions that prohibit treatment is also necessary. Lesions are structural changes in the tissues caused by damage or injury. Any mark, wound, or abnormality is described as a lesion. Primary lesions are lesions in the initial stage of development or change characterized by flat, non-palpable changes in skin, color, or by elevations formed by fluid in a cavity, such as vesicles or pustules. Secondary skin lesions are characterized by piles of material on the skin surface, such as a crust or scab, or by depressions in the surface, such as an ulcer. These may require medical referral. Acne is an inflammatory skin disorder of the sebaceous glands. It is characterized by excess sebum production. This excess oil and dead skin cells can clog pores, creating comedones, papules, and pustules and cysts. This causes a growth of Propionibacterium acne, which is also called just capital P period acne. Bacteria in the follicles are anaerobic and cannot live in the presence of oxygen. Redness and inflammation occur when that foreign debris created from the dead white blood cells is detected in the skin, and white blood cells move in to fight the infection. Papules are red, inflamed lesions caused by this process. Infected papules become pustules that are filled with fluid from the dead white blood cells that fought the infection. Cysts are nodules made up of deep pockets of infection. Skin forms hardened tissue around the infection to stop the spread of bacteria, which can lead to both depressions and raised scars from damage to the dermal tissue. Because it is in the dermis, this variety of acne, called cystic acne, should be treated by a medical professional. A comedo open at the surface is a blackhead. It is dark because it is exposed to oxygen, and oxidation occurs. A closed comedo forms when the follicles are blocked with debris and white cells. It is also referred to as a whitehead. Sebaceous filaments are mainly solidified impactions of oil without the cell matter. They are often found on the nose. Milia, epidermal cysts that appear as firm white papules. Milia are whitish, pearl-like masses of sebum and dead cells under the skin with no visible opening. Hardened and closed over, milia are more common in dry skin types and may form after skin trauma such as laser resurfacing or chronic exposure to UV radiation. Retention hyperkeratosis is a hereditary factor in which dead cells build up because they do not shed from the follicles as they do on normal skin. Sebaceous hyperplasia involves benign lesions frequently seen on oilier areas of the face and is described as donut-shaped with an indentation in the center. Do not mistake these overgrowths of the sebaceous gland for comedones or milias, which may look similar at first. These harmless lesions cannot be removed by extraction. Cryotherapy surgery or laser are recommended treatment options. Seborrhea is a severe oiliness of the skin, an abnormal secretion from the sebaceous glands, and can occur around the eyebrows, behind the ears, and around the nose or other areas of the face. It can be misidentified as acne. The androgen fluctuations during puberty, monthly menstrual cycle hormone surges, pregnancy, and perimenopause contribute to oil production changes that can bring on comedones, papules, and pustules that usually evidence themselves periodically. Premenstrual water retention can cause slight swelling, enough to influence the epidermis and block filiosebaceous units. During the consultation, get a better understanding of hormonally induced acne. You may suggest your client see their medical professional for a change in birth control prescription. If the acne developed when the client started on the pill, or with an IUD birth control device, or following a hormonal injection. If the acne is a result of hormonal changes during pregnancy and perimenopause, severity will change as the pregnancy progresses and hormonal fluctuations shift. The breakout that occurs from menstrual cycle hormone surges may be influenced by limiting sodium intake and increasing water intake. Fatty ingredients such as waxes and some oils can clog or irritate follicles. Products rich in emollients and occlusive products are too heavy for skin prone to breakouts. Moisturizers and sunscreens should be lighter formulations such as oil and water emulsions, not water and oil emulsions. Many makeup products are comedogenic, especially ones made with solids and fatty ingredients. Products for hair and skin can trigger or irritate acne. Educating your clients on routine cleaning, of makeup brushes, and the use of disposable sponges to apply foundation can help with breakouts. A number of studies are linking food allergies or sensitivities to acne. Food with higher glucose index, processed foods, and dairy are contributors to acne. Clients should see a specialist for dietary changes that may improve the health of their skin. Regular exfoliation, high frequency, microdermabrasion, and chemical peels can help the stratum corneum thin, keep oil production under control, add hydration, and oxygenate the skin to eliminate bacteria. Benzoyl peroxide products are often combined with topical antibiotics. This combination helps reduce the chance of developing antibiotic resistance. These products should be applied in the morning because they can discolor the pillowcase. Vitamin E products should be applied in the evening because they are photosensitizing, which means that it will cause your skin to be extra sensitive to the sun. These products work by thinning the stratum corneum, increasing cell turnover, and preventing hair follicles from becoming clogged with sebum and dead skin cells. Salicylic acid is antibacterial. Birth control pills are another prescription medication that can influence acne, reducing breakouts from hormonally induced acne. Polycystic ovarian syndrome is a hormonal condition that affects 1 in 20 women in their childbearing years. PCOS symptoms include acne and abnormal hair growth on the face, arms, thighs, neck, and breasts. Hair removal treatments with waxing or laser services can help keep unwanted hair under better control. Skincare treatments that influence the formation of comedones keep the stratum corneum thin. Treatments that influence acne breakouts like microdermabrasion, high frequency, and an ultrasonic skin scrubber are helpful. Rosacea is a progressive disorder that starts with flushing and increasing bouts of redness. Visible vessels and skin sensitivity are symptoms. The symptoms can progress to pustular-type breakouts that can be confused with acne. In advanced cases, the rosacea can cause skin thickening, particularly around the nose. Heredity, bacteria, and fungus are possible theories. Vascular dilation makes rosacea worse. Spicy foods, alcohol, caffeine, and temperature extremes, heat, sun, and stress aggravate symptoms. Soothing facials with gentle massage and light exfoliation limit the use of steam. High frequency to oxygenate the skin can help. Some advanced aesthetic procedures with laser intense pulsed light and radio frequency devices can be effective. Varicose veins are visible vascularity that are abnormally dilated and twisted veins that can occur anywhere on the body. They are often on the legs. Pregnancy extended period of time standing and sitting, and genetics are contributing factors. Varicose veins are treated by medical professionals. Melasma is a type of hormonal hyperpigmentation disorder that first appears during pregnancy or with the use of birth control pills. Melasma has an identifiable pattern of solid symmetrical hyperpigmentation, often on the forehead, cheeks, upper lip, and chin. Sun exposure makes it worse. Oh yeah, this is that one. This word is crazy. Poikiloderma is a skin condition caused by chronic sun exposure to the sides of the face and neck. The skin turns a reddish-brown hue with a distinct white patch under the chin. It is benign, meaning it is not cancerous. Post-inflammatory hyperpigmentation is darkened pigmentation due to an injury to the skin or the residual healing after an acne lesion has resolved. It is often deep red, purple, or brown in appearance. Sorry. Leukoderma is a loss of pigmentation leading to light, abnormal patches of depigmented skin. It is a congenital disorder acquired due to immunological and post-inflammatory causes. Albinism is a rare genetic condition characterized by lack of melanin pigment in the body, including the skin, hair, and eyes. The person is at risk of skin cancer, is sensitive to light, and ages early without normal melanin protection. Vitiligo is a pigmentation disease characterized by white, irregular patches on skin that are totally lacking pigment. The condition can worsen with time and sunlight. The disease can occur at any age and is believed to be an autoimmune disorder causing an absence of melanocytes. Dermatitis is a generalized term to refer to an anti-inflammatory condition of the skin. Various forms include lesions such as eczema, vesicles, or papules. Occupational disorders from ingredients in cosmetics and chemical solutions can cause contact dermatitis. Wearing gloves or protective skin creams while working with chemicals or irritating substances can help prevent contact dermatitis. I would like to add that wearing gloves is probably going to be the way to go, and other protective garments that can be discarded. I would not advise wearing or using skin creams, only because those chemicals and other irritants that you're trying to avoid are going to stick to that cream. So, yeah, I'm just telling you what the book said, but, if you have any of these issues, I am not a doctor, so speak with your physician, but that is my thought. So, allergic contact dermatitis is caused by exposure to and direct sunlight contact with an allergen. An allergic reaction occurs when our immune system mistakes a benign substance for a toxic one and initiates a major defense against it. Atopic dermatitis is a chronic, relapsing form of dermatitis. Irritants and allergens trigger reactions that include dry, cracked skin. The redness, itching, and dehydration of the dermatitis makes the condition worse. Use of humidifiers and lotion can help keep the skin more hydrated. Topical corticosteroids can relieve the symptoms. Perioral dermatitis is an acne-like condition around the mouth consisting mainly of small clusters of papules. It may be caused by toothpaste or products used on the face. It is not contagious. Antibiotics can help treat the condition. Stasis dermatitis is caused by poor circulation in the lower legs that can create a chronic inflammatory state. The legs may sometimes have ulcerations along with scaly skin, itching, and hyperpigmentation by staining, a brownish red discoloration due to iron deposits in the blood leaking into the tissue. Needs a cardiovascular referral. Hypertrophy is defined as an abnormal growth. Many are benign or harmless. However, some growths are pre-malignant or malignant and can be dangerous or cancerous. The term hypertrophic is used to describe thickening of the tissue. The opposite of hypertrophy is atrophy, which means wasting away or thinning. Hyperkeratosis is thickening of the skin caused by mass keratinocytes. Keratoma is a thickened patch of epidermis. Keratosis is an abnormally thick buildup of skin cells. Keratosis pilaris, redness and bumpiness of the cheeks, upper arms, or thighs caused by blocked follicles. Topical chemical exfoliants that keep the follicles free of keratin, like alpha hydroxyl acid or beta hydroxyl acid, with light mechanical exfoliation, can alleviate the rough feeling. Mole is a pigmented nevus a brownish spot ranging in color from tan to bluish black. Changes in mole color or shape should be checked by a physician. Psoriasis is an itchy skin disease characterized by red patches covered with white silver scales caused by an overproliferation of skin cells that replicate too fast. If patches are irritated, bleeding can occur. Psoriasis is not contagious, but can be spread by irritating the affected area. Can be spread on that person. You cannot catch it from someone else. Tinea. Tinea is a fungal infection that feeds on proteins, carbohydrates, and lipids in the skin. Tinea pedis, which is athlete's foot. Tinea coropus, oh, well, I know I'm not saying that right. Coporus, also known as ringworm, caused by a fungus, is not a worm. It looks like a skin irritation that spreads into a circular infection that is red and scaly. It can be spread by direct contact as well as indirect contact. Ringworm is extremely contagious. Verruca is a hypertrophy of the papillae and epidermis caused by a virus. They are not cancerous, but they are contagious. They can spontaneously disappear, but there are several treatment options, including cryotherapy, electric therapy, and surgical excision. Well, lost my place. Sorry. And chemical exfoliation. Chemical exfoliation involves the application of a strong salicylic acid at home that peels the wart off in layers. When treating a client with warts, it is imperative that you wear gloves to avoid spreading the virus. Dermatillomania is a form of obsessive compulsive disorder, OCD, in which the person picks at their skin to the point of injury, infection, or scarring. Uninformed people may assume the person has a methamphetamine addiction. Treatment includes cognitive behavior therapy and medication. Body dysmorphic disorder is a psychological disorder in which the client has a preoccupation with their appearance. They do not have a realistic picture of what they look like. They tend to fixate on minor appearance imperfections and see them as disfiguring. They may be spa hoppers or have a history of many cosmetic surgeries to fix their perceived flaws. They are dissatisfied with the outcome after treatments. This client will be challenging to manage and will require medical intervention with cognitive behavioral therapy and medication. Anhidrosis, a deficiency in perspiration due to failure of the sweat glands, can result from a fever or skin disease. Anhidrosis requires medical treatment. Bromhidrosis, foul-smelling perspiration, usually in the armpits or on the feet, is caused by bacteria and yeast that break down the sweat on the surface of the skin. Hyperhidrosis, chronic excessive perspiration caused by heat, genetics, stress, or medications. Diaphoresis, excessive perspiration due to underlying medical condition. And that brings us to the end of the summary of Chapter 4 in the Milady Aesthetics book, Disorders and Diseases of the Skin. I would like to reiterate this series of video highlights the major points of each chapter in the Milady Aesthetics book. If you have not read the book or watched the videos of me reading it in its entirety, you should do so and consider this as a basic introduction. If you have, this is a good reminder of its contents. It is not a substitute for the entire book. I appreciate you watching. I hope this was helpful to you. Don't forget to comment, like, share, and subscribe, as well as check out my other videos. Have a great day. Thanks. Bye.